The anatomy of the face and the head can readily be felt or palpated in the majority of individuals due to the thin layer of subcutaneous or connective tissue. Now, as a landmark, let's begin along the jawline, otherwise known as the body of the mandible. In the body of the mandible is this horizontally oriented portion of the bone, where if you were tired and rested your chin on your hand, you would likely be resting it on the body of the mandible. The body is going to change directions at the ramus, or to the ramus at the angle of the mandible. So if you were to move posteriorly along the body, it's going to change directions and the bone will start to ascend vertically. And this is the angle of the mandible. Now the ramus is going to continue superiorly, and if you were to continue to palpate up the side of the face, you would actually start to reach towards the zygomatic arch, which is part of the zygomatic bone or your cheekbone. Now, moving posteriorly on either side from the mandible, superiorly, you start to get after the angle towards the ear. Now, the anatomy of the ear is going to vary in some individuals where they may have an attached earlobe or not, and that portion of the ear is known as the lobule. It's a fleshy, large portion inferiorly that is often pierced. The large outer circumference of the ear is known as the helix. We also have a small prominence that is going to project from the anterior aspect moving posteriorly, covering up over the opening, the external acoustic meatus. And this small piece of tissue is known as the tragus. Posterior to the ear, we're also going to have a large bump, which is the mastoid process. And this is going to be one of the attachment sites of the muscle in our neck, the sternocleidomastoid. Again, readily felt posterior to the ear, and this is part of the temporal bone. Moving towards the back of the head, there's often a bump that can be felt right in the midline towards the base of your skull. This is the external occipital protuberance, and it's part of the occipital bone. So these are landmarks that can easily be felt in an individual. We're also going to have some landmarks that are simply seen visually, but could also be touched or felt, including around the circumference of the oral cavity, where we can see a change in color from the fleshy pink type of appearance of our lips towards the rest of our skin of our face. And this is known as the Vermilion Border, and it may be more or less pronounced in different individuals. Superiorly to the upper lip, we're going to have a small depression or indentation in line with the nose, and this is the philtrum. The philtrum is going to lie in the midline to either side of the openings to our nasal cavity, the external nares, otherwise known as the nostrils. Moving superiorly, along the bridge of our nose, we can feel the nasal bones. From here, if a physician were to palpate laterally, they'd be moving along a bony prominence known as the superciliary arch, or the brow. And in many individuals, there's a small indentation known as the supraorbital notch, which is where we're going to have neurovascular structures from the orbit reach the forehead.